Welcome to the Penn Transplant Institute. This presentation will provide a general overview of solid organ transplantation and help you understand the process from evaluation to surgery and through post-transplant care. The goal of this presentation is to help ensure that you have been fully informed about becoming an organ transplant recipient and that you voluntarily wish to proceed with the evaluation. We will begin with the informed consent process and an overview of the multidisciplinary team who was involved in your transplant evaluation and care. In order for you to decide whether or not you wish to consider organ transplant as a treatment option, you should understand the risks and benefits of the evaluation process, the transplant surgery, and the long-term outcomes after surgery. Transplant is a complex process, and it's our goal to ensure that you become fully informed about the organ transplant evaluation process, procedure, and the potential risks and complications that accompany a transplant. It is also our goal that you understand all that is involved in evaluation, including your responsibilities as a patient and ours as a transplant program. Before we can officially start your evaluation, we must obtain informed consent for the transplant evaluation. Informed consent is a process of education that begins before and continues throughout your evaluation process and results in you obtaining full knowledge and understanding of the purpose, possible risks, benefits, and alternative options to transplant. You will be given this information in this presentation in writing and be asked to sign the Transplant Education and Informed Consent form prior to initiating your evaluation. This indicates that information was provided to you or to your healthcare representative, and that you are willingly participating in this process. Throughout your evaluation, you will meet members of the multidisciplinary team who specialize in your disease and transplantation. These individuals will address your transplant-related issues and participate in decisions regarding your candidacy for transplantation. The multidisciplinary team members who participate in transplant evaluation and care include a transplant coordinator. This is a nurse who coordinates your care throughout the entire transplant process and provides education regarding the evaluation process, listing for transplant, and patient responsibilities before and after transplant. This is your primary point of contact with the transplant program. The transplant surgeon participates in your evaluation and performs the surgical procedure. He or she will discuss with you what it means to agree to a transplant, explain the surgical procedure, the risks of the surgery, and possible complications after transplantation. The surgeon will also discuss how transplant is expected to improve your health and/or quality of life, the expected hospitalization time, and post-transplant recovery period, and when you may resume normal activities after transplant surgery. A transplant physician is a doctor who specializes in transplant medicine for your native organ disease and will work with the transplant team to determine if you are medically suitable for a transplant. He or she will review your history, perform a physical exam, and review risk factors, and also manage your transplant-related medical care after your surgery. A transplant advanced practice provider is a physician assistant or nurse practitioner with transplant training. They participate in your care throughout the pre- and post-transplant process. They may assess your risk for transplant and manage your pre- and post-transplant care as well. A transplant social worker addresses financial, social, support system, and psychosocial issues throughout the process, and this is before, during, and after transplant, to ensure that you have the support to undergo a successful transplant. Social work will evaluate your social support system, your ability to cope with the stress of transplantation, and your ability to follow the recommended treatment plan both before and after transplant. The social worker will help you to identify your caregiver team as well. A financial coordinator reviews your insurance coverage and will discuss the costs associated with your transplant and with medications you will require after transplant. They will help you understand your insurance coverage and financial responsibilities, including costs that may not be covered by insurance. A transplant dietitian assesses your nutritional needs before, during, and after transplant. He or she may need to meet with you as needed based on your health situation. And the transplant pharmacist. Since you will be on anti-rejection medications for the life of your transplanted organ, the transplant pharmacist reviews your medications before, during, and after transplant to minimize side effects and interactions, and works with your transplant team to provide recommendations. The transplant pharmacist will also meet with you and/or your caregivers after the transplant to teach you about your new medications. The transplant evaluation process. You will be required to complete physical, psychosocial, and financial evaluations prior to being placed on the transplant waiting list. At minimum, this includes medical and psychosocial consultations, blood tests, and diagnostic studies to determine if transplantation is the best treatment for your disease. Note that you may choose to stop the transplant evaluation process at any time. During the transplant evaluation process, you will undergo a medical history review and physical exam, multidisciplinary assessments, including but not limited to psychosocial, nutrition, and financial consults. The multidisciplinary, along with the medical evaluations, address if you are an appropriate transplant candidate and that you have the ability to adhere to the strict medical plan, which must be followed after transplant. You will also undergo laboratory studies and diagnostic testing such as X-rays, electrocardiograms, ultrasounds, or CAT scans. You will be required to attend an organ-specific education session where you will learn about patient selection criteria. Each organ program at the Hospital of the University of Pennsylvania has selection criteria to determine which patients are eligible to undergo transplantation. You may request a copy of our transplant recipient selection criteria at any time. The organ-specific education session will cover the purpose or reasons for needing a transplant, possible risks and benefits of a transplant, and other disease treatment options that may be available to you. It will also review factors which could result in removal from the transplant waitlist and the organ program's outcomes or survival rates, as well as national outcomes for that organ. The transplant team will notify you about your lab and diagnostic test results as they become available throughout the transplant process. They will also review and discuss with you any psychosocial issues which may affect the success of a transplant and any financial responsibilities you need to be made aware of. Additionally, alternative medical or surgical treatments available for you will be discussed prior to and during the evaluation process. And if you have a significant change in your medical condition or if disease treatments become available with advancements in science, these alternatives to transplant will be reviewed. Your responsibilities include completing the recommended diagnostic testing and consultations, and notifying the transplant center, your coordinator, of any changes in your contact information, insurance coverage, or health information throughout the transplant process. The patient selection process occurs once the evaluation is completed. The results of your evaluation will be presented to the Multidisciplinary Patient Selection Committee meeting. The committee will make a decision about whether you are a transplant candidate or not, and whether to place you on the wait list or end your evaluation. The decision is made in your best interest and in the interest of the organ, which is a scarce resource. Your transplant coordinator or physician will inform you of the decision. Decision options regarding waitlisting and transplantation could include: you meet our selection criteria for transplant and will be placed on the national waiting list for transplantation after your insurance company gives us the authorization and we have all the needed test results for listing. We will continue to care for you in our clinic periodically while you are on the waiting list. And note that if your health or social status changes while on the wait list, your candidacy may need to be reconsidered. Another decision option is that you may need additional studies or consultations before a final decision can be made. You may also be asked to meet additional goals related to your own health status. You will be represented to the selection committee at a later time for reconsideration to be placed on the wait list. We will continue to care for you in our clinic periodically. And the last decision option regarding waitlisting or transplantation is that transplantation may not be the recommended option for you at the current time, and you will be informed of the reason for this decision. Your care may be returned to your referring doctor if this is the decision. Note that in some cases, a patient may still be recommended for listing for transplant even if he or she does not meet selection criteria, if an exception is agreed upon by the transplant team. The transplant program responsibilities include notifying you of your results from evaluation testing, informing you of the decision of the patient selection committee regarding your transplant candidacy, notifying you of your status in evaluation or on the wait list, need for any additional testing, and informing you of national and center-specific outcomes. Your disease will continue to be managed with appropriate medical treatments throughout the transplant process, but effectiveness cannot be guaranteed. End-stage organ disease management may be done by your referring provider in consultation with the transplant team, as deemed appropriate based on your individual needs. The transplant surgical procedure and its risks will now be reviewed. Your transplant team will provide you with organ program-specific surgery information in terms of the actual procedure, risks and benefits, alternative treatment options, expected hospital and post-discharge course. Remember that you must follow a strict medical regimen, including medications, office visits, and diagnostic testing after transplant. There are general risks of receiving anesthesia and risks associated with using blood or blood products, which will be reviewed with you during your evaluation process. The anesthesiologist will talk with you in more detail about the risks of anesthesia. Blood transfusions may be needed during and after surgery. You will be asked to consent to the use of stored blood and blood products. Although all blood is carefully checked for HIV, hepatitis, and other diseases, there is still a small risk that you could be infected. You will need to sign a separate blood transfusion consent form at the time of surgery. There are potential medical and surgical risks of any organ transplant surgery, including infections like wound infection, donor-derived infections, infections from blood products, and pneumonia. Blood clots, which may lead to serious complications or even death, are a risk. Organ transplant rejection, organ failure, or that the organ may never work. Any of these organ issues may make an organ retransplant necessary. You will require anti-rejection medications for the life of the organ, and these medications carry potential side effects and risks which will be reviewed with you throughout the process. Other serious risks include multi-organ failure, stroke, or even death. There are general risks associated with all types of organ transplants, and there are risks specific to each organ type. These will be discussed with you prior to your decision to proceed with evaluation. Many complications are minor and get better on their own. In some cases, the complications are serious enough to require another surgery or medical procedure. The surgeon will explain the risks of surgery to you, and you will need to sign a separate consent form at the time of surgery. General risks applicable to all organ transplant types are described below. Your transplant coordinator and physician will discuss them, as well as any risks applicable to your specific organ type with you. Delayed response of the new organ. There may be a delay in the function of your transplanted organ. Such a delay may increase the length of your hospital stay and increase the risk of other complications. The new organ may not function. This is a possibility that the transplant organ will not function. In some cases, a second transplant may be needed. If another organ, with the exception of a kidney, does not become available soon enough, death may occur. Rejection. Your immune system may recognize the transplanted organ as not being yours and cause damage to the new organ. Medications. You'll be required to take medications for the rest of your life that suppress your immune system to prevent rejection. These medications are called immunosuppressants. Side effects from these medications include infection, tremors, headaches, kidney problems, digestive problems, irregular blood lab results, nerve damage, weight gain, and others. Your chance of developing diabetes, high blood pressure, and kidney problems may be increased by the long-term use of these drugs. The transplant team watches closely for side effects and may make adjustments to your medications to help avoid these complications. Infection. The risk of infection is higher for transplant recipients than other surgical patients because the treatments needed to prevent organ rejection make the body less able to fight infection. Sites of infection may include, but they're not limited to, the wound, bloodstream, lungs, bladder, or abdominal cavity. Bleeding. Blood transfusions may be needed during and after surgery. You will be asked to consent to use stored blood and blood products as part of the surgical consent. Although all blood is carefully checked for HIV, hepatitis, and other diseases, there is still a very small risk that you could be infected. If you have an objection to receiving blood transfusions or blood products that are needed during or after surgery, you should discuss this with the transplant physician or surgeon during the evaluation. Blood clots. Blood clots may form in the legs and could break free and move into the heart and lungs. This can cause serious problems with breathing or heart function and may lead to death. Death or stroke. Most patients do well after organ transplant. However, transplant is a major operation. If there's a lot of bleeding or low blood pressure for a long time during surgery, then stroke, abnormal heart rhythms or arrhythmias, multi-organ failure, or cardiac arrest or collapse can occur and could lead to death. Other possible complications: injury to parts of the body, pressure sores on the skin due to positioning, burns caused by the use of electrical equipment during surgery, damage to arteries and veins, pneumonia, heart attacks, stroke, or permanent scarring at the site of the incision are some of the potential complications. There are potential risk factors which may affect the function of the donor organ and/or your health after a transplant. These factors include, but are not limited to, the donor's past medical or social history, the donor's age, the condition of the organ, and/or an infection in the donor. Despite extensive testing, there is always a very low risk of contracting diseases like HIV, hepatitis B, hepatitis C, malaria, or cancer. Based on the donor's medical and social history, this risk may be increased and will be discussed with you at the time of organ offer. It is important to know that donors have undetectable infection at the time of donation. Your transplant team will review organ donor-specific risks. Issues which may affect the success of your organ transplant and issues that may place your health at risk will be reviewed. When a donor organ becomes available, you will be called to come to the hospital. When the organ is offered, the transplant team will determine if it's a good match for you, and you will be informed of the possible known risks associated with this particular organ versus the risk of waiting for the next available donor. As noted, you will undergo thorough pre-transplant psychosocial assessment during your evaluation. However, there are some psychosocial risks related to the transplant and major surgery that may impact patients and their families. These may occur at any point in the transplant process, despite a thorough assessment during your evaluation. Your illness and/or an organ transplant may alter your daily routine, dietary habits, and strain your finances. The stress of the surgery may make it difficult for you to make the lifestyle changes that may be needed. You should be aware that this psychosocial impact may include, but are not limited to, depression, generalized anxiety or anxiety due to the dependence on others, post-traumatic like stress disorder, or feelings of guilt. Likewise, there are financial risks associated with transplant that you should also understand. First, there's a possibility that the treatment of future health problems related to transplant may not be covered by your insurance carrier. If this occurs, alternative financial resources will need to be explored. There is also the possibility that medical insurance, disability benefits, and life insurance may be denied or jeopardized after transplant. Next, we'll review the transplant program requirements and the requirements of the physician and surgical team. The transplant physician and surgical team requirements include that a transplant surgeon and transplant physician must be available 24 hours a day and 365 days per year. A transplant physician and surgeon must be on call 100% of the time. Transplant programs must have at least 2 transplant surgeons and physicians to provide coverage. On-call surgeon or physicians are available to review donor organs offers for potential recipients. Transplant surgeons and physicians are available to assist with urgent patient care issues and must be able to be on site at the hospital within 60 minutes. Transplant outcomes and resources. Note, National and Transplant Center specific outcomes are available. Patient outcomes for those who have transplants are reported from the UNOS database to the OPTN SRTR. This is also known as the Organ Procurement and Transplantation Network and Scientific Registry of Transplant Recipients. Transplant recipient, patient, and graft survival rates for the Penn Transplant Institute programs and how they compare to national averages will be provided separately. The information is updated twice a year in January and July. Additional SRTR data and OPTN information is also available via their respective websites and may be used to review transplant data pertaining to programs' performance and help you make an informed decision about listing with the program. Please contact your transplant coordinator for any questions or assistance with use of these websites. Transplant outcomes. National and Transplant Center specific outcomes from the most recent SRTR report will be provided separately, and this information will include Penn Transplant Center's observed and expected 1-year patient and organ survival outcome rates, national 1-year patient and organ survival outcome rates, and how Penn transplant outcomes compare to the national averages, and whether the latest SRTR specific center report outcomes comply with Medicare's outcome requirements. Transplant centers are required to notify you if their outcomes do not meet Medicare's outcome requirements. The transplant resource locations will be provided to you. The SRTR website is used to review national and center-specific transplant outcomes and compare them with other centers. The OPTN website is used to learn more about the transplant process and options. The UNOS phone number can be used for general transplant-related questions or regarding problems you may experience with transplant centers. Your transplant coordinator may be contacted at 215-662-6200 to assist you with any questions regarding SRTR, OPTN, or UNOS contacts or websites. So how to use the SRTR? Go to www.srtr.org. As seen in the picture, you may select an organ, then search by zip code or center name. After you choose your programs, you will see a screen that looks like this. You can use this information to compare transplant centers. 3 bars is performance as expected. In this example, Center A had 72 transplants from deceased donors last year, and Center B had 80. Both centers have a slightly lower than expected survival on the wait list with 2 bars. Center A has a slightly higher than expected transplant rate with 4 bars. Center B's transplant rate is as expected. Center A's 1-year graft survival is much better than expected with 5 bars. Center B's is better than expected with 4 bars. This can be difficult information to understand. So if you have difficulty, again, please contact your transplant coordinator at 215-662-6200. Next, we're going to review some rights and regulations. The right to refuse transplant. It is important for you to know and understand that you have the right to refuse transplant and withdraw your consent to transplant at any time during the process. As reviewed earlier, your transplant center is required to notify you if they do not meet requirements by CMS to be a Medicare-approved center. If your transplant does not occur in a Medicare-approved transplant center, immunosuppressive drug coverage under Medicare Part B could be negatively affected. The Transplant Institute will notify you if outcomes change and Medicare requirements are not met. Notification of Medicare outcome requirements not being met by the transplant center. Again, the transplant center at Penn currently meet the requirements for transplant centers as required by the Center for Medicare Services, otherwise known as CMS. We will notify you if our outcomes change and do not meet the Medicare requirements for transplant centers. Transplantation by a transplant center not approved by Medicare can have consequences. If you have your transplant at a facility that is not approved by Medicare for transplantation, your ability to have your immunosuppressive drugs paid for under Medicare Part B could be affected. The transplant programs at Penn Transplant Institute are Medicare approved. Transplant centers are required to provide notifications to patients of the following: information about the center, which could impact your ability to receive an organ if it becomes available, procedures to ensure availability of your transplant team, the absence of a surgeon or physician, which may impact the ability of a patient to receive a transplant if an organ becomes available, if a transplant center is served by a single physician or surgeon, that this may impact the candidate's ability to receive a transplant when the organ is available, and this must be disclosed. And process to provide an alternative surgeon must be also disclosed. Any changes occurring after the informed consent process must be shared with each candidate on the wait list. UNOS requires that transplant centers provide notifications to transplant candidates of the following: transplant candidates may register at more than one transplant center. Transplant candidates may transfer their waiting time to another center. Once a candidate is placed on the national waiting list, the transplant center must send the candidate a letter. Once a candidate is removed from the waiting list for reasons other than death or transplant, the transplant center must send a candidate a letter. The OPTN patient information letter must be provided at the time of listing or wait list removal and can be found in the website on the screen. Multiple listings and transfer of time. Per UNOS policy, patients may choose to be listed at more than one transplant center or have their waiting time at the hospital of the University of Pennsylvania transferred to another center, or waiting time from another center transferred to Penn. Being listed at more than one transplant center, also called multiple listing, may increase the chances of receiving an organ offer. The transplant coordinator is available to assist you in completing the form needed to transfer your waiting time. You must sign the form to request the time transfer. If you have a transplant at another center, that other transplant center will provide your post-operative care. This concludes the transplant general education. Please notify your transplant coordinator with any questions regarding this content.